Hey people, how you doing? Welcome to the Sports Therapy Association podcast, episode 204. My name is Matt Phillips, creator of RunChatLive.com. And as always, this episode has been recorded live on the Sports Therapy Association YouTube channel and Facebook page. Although tonight, if you are joining us live, it is on a Wednesday rather than the normal Tuesday. And next week, it's going to be on Wednesday as well. But if you are listening to the podcast and you like the idea of joining us live, then just have a look on our social media, UK_STA, or me at Run Chat Live, and you will see when we do change sometimes from a Tuesday to a Wednesday. So very shortly in this episode entitled Therapy for Swimmers, my guests are going to be Carla Bickerstaff and Jenny Lane, who will be discussing the ins and outs of working with swimmers, including triathletes. But firstly, a huge thank you to my guest last week, who was Jane Wigg. Let's bring these up for people who have joined us live. Jane Wigg, who is the director of Lymphedema Training Academy, gave us a fascinating episode on lymphedema management for manual therapists. It's available, as always, on all popular podcast apps and YouTube. And it really was a great insight into where we are at the moment now with regards to manual drainage and lymphedema. And it really was an eye-opener to how, once again, we need to update our thinking a little bit. Jane Wigg is at the center of a lot of research into lymphedema. So it really is a great episode, and I recommend you listen to it. Also, I just want to mention, this is for STA members only. There is a coffee chat special coming up with a great friend of the podcast, the amazing Rachel Francis Thompson. It's going to be all about biomechanics. And if there's one person I wanted to listen to talking about biomechanics, it would be Rachel Francis Thompson. So that is for members only, I'm afraid. But if you are listening to the podcast and you're thinking, oh, maybe this sounds like a reason to join the STA, then that would be one of them. It's one of the many reasons. It's number 11B. For joining the STA podcast. But that'll be on Wednesday, the 17th of July, next week at 7:30 p.m. It will be in direct competition with my podcast next week, but that's fine. Just choose what suits you better, and then there'll be no judgment. That'll be fine. Details, as always, are going to be in the members-only Facebook page for the Sports Therapy Association. So do check it out there next week, 7:30, coffee chat special. Right, that's it. Tonight, we are going to have Therapy for Swimmers. It is part of our first Tuesday or Wednesday of the month, Ask Us Anything. I spent a long time trying to get a big panel put together, and my two next brave, wonderful guests stepped forwards and said, we will represent therapists working with swimmers. So it gives me great pleasure now to bring up for you, for tonight's episode, Therapy for Swimmers, guests Carla Bickerstaff and Jenny Lane. Hey, Carla. Hey, Jenny.
Hi.
Congratulations. Thank you from the bottom of my heart for actually stepping up and doing this. I know it's nervous. Jenny, you've already admitted, yeah, a little bit nervous, Matt. Yeah. But thank you very much. You'll soon, within the next, probably in my introduction only, you've realised that this is a very relaxed output. It really is not going to be anything too technical. But what we are going to get from you is your experience of working with swimmers, which I'm very excited about. I've already kind of held my hand up to the fact I haven't worked with many swimmers at all. It's all runners for me, with the odd triathlete thrown in. So thank you very much. Really looking forward to it. Let's start then, for people who don't know, maybe start with you, Carla. Let us know where you are in the country. That would be interesting. And also how you got into working with swimmers.
So I am a sports therapist by trade, and I'm based in Sheffield. But I do a lot of event work as well and clinical work. I have worked in swimming in various capacities for the last 15 years. I started out as a competitive swimmer at the age of 12, then moved from swimming myself into masters swimming and competing as a master swimmer and coaching alongside that. So I've done a coaching role in swimming, and I still am involved in coaching able-bodied and para swimmers, and then I now do a lot of sports therapy work with swimmers, and I've done that more so for the last 10 years of my coaching career, if you like. I've done it alongside that. So yeah, it's very interesting, and I think I just really enjoy it. I've always done swimming. It seemed like the next logical step for me, really, just to sort of add this extra skill that I've done at university. Why not throw that into the mix as well and see where we go, kind of thing. So yeah,
that's great. I mean, people may know, if you're a keen listener to the podcast, you were part of the panel for episode, where was it, back in can't remember what number it was now. I did have it written down here somewhere. But you joined us for when we were talking about how to set up a sports or how to set up a clinic with regards to the mobile and event work. So is the mobile and event work something you've done a lot with swimming then?
So more so events than well, I don't know if you call it mobile. I've been poolside during training sessions, so yes, I suppose you could class that as a mobile work. But more so predominantly events. Been based at those and worked that way. So a mixture of everything. I've seen people in clinic, I've seen them on pool deck, I've seen them at competitions. So a whole variety to go at.
Sometimes that's lovely. I mean, I'm the same. I do love variety. It was episode 188. I found it now. How to set up a sports massage therapy business, part 3, mobile and event work. So if you're interested in that, then do listen back to episode 188. Thank you, Jenny. Let us know where you are and how you got involved with working with swimmers.
I'm in Loughborough, and I don't have as much lovely experience as Carla does from a point of view of actually being a swimmer. I do swim, but I tend to find mine's a bit more recreational, really. I tend to use it more for relaxation and sort of social, really, more than anything else. A group of my friends started doing some long distance swimming and open water swimming and a bit of cold exposure therapy. And so I've kind of got in it from that point of view, really. So periodically I decide to challenge myself and do some longer distance open water stuff. But essentially my clients come from triathletes and ultramarathon. I forgot what they're called now. That's dreadful. Ironman, thank you. That's the one.
They're the ones.
Ironman and half Ironman type of events. So they're the people who come to see me a bit more.
And you've crossed over at similar events as well, haven't you, with Carla?
Yeah. So we did the World Para swimming competition. I think, Carla, you said it was 2019, wasn't it?
Yeah, it was. Yes, sort of November time, 2019. I think it was. It was in London. We were based in London. It was the World Champs.
Yeah, and then we did the Commonwealth together in Sandwell, which was really good with all the swimmers. So it was great. Really good.
So you've both got quite a lot of experience then, both with competitive swimmers and recreational swimmers, particularly in your case, Jenny. Yeah, and the different types of swimmers as well. So we're going to hear about open water and long distance, and it's going to be an eye-opener because just the word swimmer, once again, you can't just classify them all the same. And I imagine when we start talking about it, you can't classify all the injuries in the same bucket because it depends on whether they are distance swimmers or whether they are open water or whether they're competitive. So really looking forward to it. Great. I'm just saying quick hi to people who are listening and joining us live. Hi, Cecily Hislop. Good to see you. Thanks for joining us live. And Sir Glenn Murphy, MBE. Great to see you, Glenn. Thank you very much for joining us. If you are listening live, whether it's via YouTube or via Facebook, then do feel free to ask our guests questions, anything and everything to do with working with swimmers. So let's get into actual injuries then. I've already kind of suggested, bit of a spoiler it was actually, that depending on what type of swimmer you are, you're going to have different injuries. But what are we talking about in terms of, or maybe we have to start off by saying, what type of swimmer, and then what are the most common injuries? Who wants to start the ball rolling?
Well, I wouldn't say there's a particular type of swimmer, but I would say the most common things that I have seen are shoulders, like shoulder issues, and lower back and hip issues, which seem to be really common no matter who you are or what swimming you do, just from the repetitive nature of the strokes and the amount of pressure you are putting through those joints whilst swimming and obviously if you're swimming at a high competitive level, there is a lot more sort of at stake to perform. But then also if you're talking more stroke specific, potentially like knees for breaststrokers, but even little things like ankles from the hundreds of thousands of turns that people do in a swimming pool, diving off and doing multiple starts in training and things like that. They can, surprisingly, you can roll your ankle just pushing off a wall. So you don't have to fall off anything. So yeah, it's not always just the common stuff that you think you're going to get. Sometimes you get the odd thing that will come in and they'll be like, oh, how did you do this? And they'll be like, yeah, I just pushed off a wall swimming. And you're like, oh, okay then. Interesting. So I would say if you are going to work with swimmers, be prepared for anything and everything.
That's really interesting. I would have guessed the shoulder, but I would never have imagined, of course, the push off the wall. Great. Jenny, your experience, same sort of category, is it? Shoulders most of all, and then lower backs, and then a variety of other things?
Yeah, absolutely. I think probably more with the open water stuff, necks are quite a big issue as well, just simply because your position when you're in a wetsuit is slightly different, and you then have to sight as well to see where you're going, because otherwise you just end up going miles off track and things. So you've got no lanes and ropes particularly to guide you as to where you are, and particularly if it's a bit choppy and you're feeling a bit sick, which is quite common, you get disorientated. Well, I did anyway.
This is already our mind blown, because there's such a variety out there depending on where you are. I mean, again, all I can come from and compare it to is running, which I'm already running at. But running, we've got different types of terrain where there's kind of parallels and distances, obviously. But I'm wondering, comparing it to running, so that's all I can do. I mean, research has kind of shown that an 80% of running injuries are key factors: inappropriate training or inappropriate loading. So basically doing too much too soon or too often. And for runners, one of the big reasons for that, and running's got a massive kind of injury prevalence, is because a lot of the time runners can just put their shoes on 365 or 6 days a year and go for it. And they can stay out as long as they want. They haven't got to rely on teams or anything. In your experience for swimmers, is that a big factor as well? Are you having to tell swimmers, look, you're just doing too much, or you're doing it too often, or you need recovery days, or you're going too fast? Is it similar, or is there a whole different array of possibilities?
Essentially, yeah, exactly the same type of thing. It's one of the biggest thing really that we tend to see, and Carla, I don't know whether you agree, but is overuse injuries and fatigue. In a similar way to running, where it's a repetitive nature. It's exactly the same, and it's the force production behind it. It's exactly the same. So, if you're doing speed sessions, you're going to have the same kind of sort of classic mode for injury, really. So it's exactly the same. So speed, distance, everything. I would personally say, Carla, would you say the same thing?
Yeah, I think it's a bit different. It depends whether you're doing it recreationally or competitively. If you are swimming competitively, you're very limited on your pool time, because there's always a constant battle with councils and things like that for hiring their facilities, because they have to provide swimming lessons and everything like that. So if you are part of a competitive club, when you get in the pool, some coaches are like, right, we've got to cram in as much as we can because we've only got this 2-hour slot. So we have to go like hell for leather for 2 hours. Whereas other coaches are very conservative, and they will plan really well. And across the board, most people are really good. Sometimes you will get the odd younger kid who is quite talented, and for whatever reason, be it a coach is excited to get them progressing, or parents are quite pushy and want to see them improve quickly, they can get caught into the mill of doing too many sessions before they're ready for it, and before they've developed correctly. So there's a big element of understanding like the child development and everything like that, and being able to advise parents and coaches. And so yes, it can happen more. I don't know if it's more in a pool or more like if you want to go and swim in a lake, there are certain places you can just turn up and do it. And obviously, if you were to do that every day, that could have the same effect, I suppose.
Yeah, absolutely.
With the swimmers, I mean, runners, there's some people like to do both, but then there's some people like really just love the trails. They need to be in the open air with cows and all that sort of stuff. And other runners don't like that. They prefer, just running straight along the promenade or staying on the road. In swimmers, is there kind of different, different lanes and kind of which attract swimmers, where they either, I'm a pool swimmer or I'm an open water swimmer, or is there a crossover?
I think it's probably related a bit to whether they're triathletes or not as well. So potentially, not all triathletes want to just go out into the open water, but it tends to be just a big part of what, if they're going on to bigger events, that they naturally kind of progress onto. But I think there's like we were saying before, I think there's a cold water element that brings a whole nother dynamic into it as well, which isn't any kind of distance, and there's a very small likelihood of injury other than cramp, which is difficult, particularly as well if you're in open water. You kind of, you've got nowhere to hang on to if you've got that, so it can be a bit of a problem. But yeah, I think you do tend to get people who prefer to not be swimming in a pool where there's chlorine, and there is an element of some people who really like the freedom of being out in nature, in an open water, rather than turning continuously. But again, as you say, I think it can cross over, but yeah.
Are there advantages of either? Do you find yourself once saying, I'd really like to do a little bit more pool swimming, or I want you to go and do some open water? Or does that not really happen? That would not make sense. In a rehab routine, for example, would there be a time saying, I need you to use the pool a bit?
In the winter?
Makes sense.
I also think technique as well. If you're trying to improve your technique to a certain extent, it's from the open water point of view, it's much better to do it in a pool rather than and then transfer it into a lake, because of the other elements that you've got to think about, because of the wind, because of the weather, because of the cold. There's times when it is so cold that unless you've been training to get into the water at a certain temperature, it's just not a sensible thing to do, and you can't be in there for any length of time. So pool work is then essential.
Yeah, and I think coming back from an injury as well, if you've had a previous injury, if you are an open water swimmer, or if you are even a long distance, the guys who tend to do longer distances in the pool, so like your 800, your 1500 swimmers, they might venture out into open water to sort of do a 5k or a 10k, but they are doing loads and loads of pool sessions as well. Or I mean, if you look at elite guys, they might even live in the warmer countries where they can access open water that is not going to be freezing year round, things like that. So yeah, I think it's a bit of a mixed bag, especially in competitive swimming. It's more a stroke thing than a distance thing. You are either like a freestyler or a backstroker. Like that tends to be your split in your sort of lanes and things, rather than, but you do get the sprinters and your distance as well there. So there's a whole host of factors contributing to loads of things.
And I suppose that's the same with the triathletes as well. You get different distances with your triathlete or your competition. So you can go from quite a relatively short swim, which you can do in a pool, much longer swims, which obviously generally are in open water.
Great. You mentioned strokes, which is great because I was thinking about that. So again, like in running, we talk about how there's no one optimum running style. When you get to the more elites, then there's more similarities, but there's still variety, and you only have to watch certain races. You can see differences in whether they've got longer stride lengths or faster cadences, whether they're upright or leaning forwards a bit. There's all sorts of different differences. A lot of them haven't got symmetry. There's some famous examples, where they look like if they walked into a clinic, they'd be, all right, I know what's causing your neck pain. It's like, I've just won a medal with this neck movement and it's kind of helping me. So I'm interested with swimming, with the different strokes. Is it regarded as there is an optimum style? Do coaches go for an optimum style, or is there a variety you see amongst recreations and elites, which could, for example, make you think, that's why you're getting injured, when really it's just anatomical variance and kind of like differences you should expect?
So if I come at it from a coaching point of view, you are taught like the fundamentals of how you move through the water to do a stroke. That is the same for everybody, regardless of who you are. As you grow and you develop and your strength and your power develops, that's where it becomes a little bit more individualized. But fundamentally, backstroke is backstroke. You have to lie on your back and you have to do a circle with your arms. You can't get away from that. So everybody is doing that, but they are looking for a 1/10 of a second to make them that much faster than somebody else. And that might be the way that their hand enters the water. And if they rotate their wrist slightly too much, it then obviously transfers down the arm into the shoulder, which then it can create an issue within the shoulder. So you are looking for the minutest of details when you're looking at unpicking somebody's stroke if they're coming in with a shoulder issue. So it's not always that easy to do in clinic, because you can say to somebody, well, show me how you swim, but that's really difficult to do on land. Like you really need to see them in the water and be able to watch them, and maybe even talk to their coach with them to say that they've come to me with this issue. If you don't know anything about swimming, you can talk to their coach and go, does their stroke look okay? Is there anything within that stroke that we could maybe look at tweaking to see if it makes a difference to that, what they're feeling in their shoulder with that issue? Or do you need to unpick it and go right back to basics and really start again with them to prevent that issue either becoming a long-standing one or getting any worse? It's I don't know if that really answers it.
No, you have. Yeah, no, makes perfect sense. Yeah, I like the fact, you've got to lie on your back and put your arms behind you. Yeah, there's not as much variation really in terms of whether your body's going to sink down a little bit one end or where you're going to be in the water. It's kind of seems a little bit more restricted than maybe running or something when you're on land.
And obviously there are certain, in competitive swimming anyway, there are certain rules for each stroke that you have to follow in terms of how you have to swim them. And like when you perform a turn, it has to be performed in a certain way. So that's very restrictive in the mechanics that you can play around with, because there's only one way to do it, and it's who can do it the fastest.
Yeah.
I think there is a guy who's sort of doing more open water swimming and much more longer distance swimming called Adam Walker, I think it is, and he got injured. I think he was playing rugby. He had knee issues and shoulder issues, and there are people out there who develop a different types of strokes, but I don't think you'd see that in competitive swimming so much. I think that would be more either in recreational or the open water swimming, because I think there is a bit of leeway with open water swimming, just because there's lots of different factors that can affect you, and particularly if you're going that. I mean, I think he swims 7 of the most difficult oceans and waters and all sorts of things. So he's very much more very long distance, and I think at that point he's developed this particular technique, which is meant to be really helpful if you have had injuries. I don't know much more about it than that. But
that's very interesting. I like it. Yeah, if it's endurance is your goal, then you might find different ways of doing it to minimize kind of energy expenditure and that sort of stuff. So let's go to shoulders then for a second. Is there, and I'm showing my ignorance again here now, is there a very common mistake which, let's stick with crawl, for example. Is there a mistake which a lot of swimmers, maybe recreational swimmers, make which leads to particular injuries? I mean, can you think of one where you would need to see how they swim because, you're doing this and that's why you're getting an overload on this particular muscle, or is it not as clear as that?
So normally it is to do with body position and hand entry, and how people are breathing. So generally speaking, you're taught to swim front crawl, face in the water, and breathe to the side. If you're somebody that doesn't like putting your face in the water, you will try and stick your head up the whole time.
Okay.
And swim in front crawl, which then alters the mechanics of everything and makes everything really difficult. So that can then obviously cause neck issues and things like that. So that's a little bit easier to sort of get around in clinic, because someone will say to you, I hate putting my face in the water.
Got you.
And already then you can be like, right, well, these are the reasons why, and work on it. If it's something as like I was saying before, the angle that they're putting their hand in the water, you're not going to know that without seeing them in the water and watching them. Because I think,
sort of following on from that and sort of going into the breathing side of it all as well, you have some people who bilaterally breathe and some people who won't be able to do that, either because they can't, when they're breathing out, they might take 3 strokes and then breathe out, or some people will take 4 strokes, and it depends on where how you breathe, basically, as to whether you're going to unilaterally breathe or bilaterally breathe, and that's hugely into the neck and shoulders. Really, that makes quite a big difference, I think.
Very interesting. I like it. So I want to go back to the point you made about, it's tricky, isn't it? Because like with runners, you might have a treadmill, you can put them on the treadmill, and there might be a few differences, but most of the research suggests that on the treadmill, they're going to run pretty accurately to how they're outside. It might be slightly faster cadence, it might be more vertical oscillation, but generally it's enough for you to make a clinical judgment. But with swimmers then, how do you get around that? I mean, if you can go and see them in the pool, that's great, but that might not be realistic for everyone. So does video work at all, or what are some of the other options you've got?
Yeah, you could get them to video a session of them. I mean, you can ask them to show you in clinic, but and you can apply forces that would simulate what they do in the water, and like you would do with like special testing and things like that, to see if that brings on the pain that they are feeling or the discomfort they're feeling. But again, having worked with swimmers, when you ask them to do something on land, 9 times out of 10 it is not what they do in the water, because it's a very different feeling. The feel of the water is very different to being on land. And
how would you do that? Would you try and lay them out kind of horizontally and
you can do that. You could use your couch and do that. Yeah. You can also do, like, you can do it in standing, and sort of forget about the legs aspect, unless it's a leg issue, and then I don't know, you'd have to experiment. Like, I ain't got a clue on that front. But shoulder wise, upper body wise, you can do it either on the couch or in standing, and get them sort of like half lean over, like leaning forwards if it's a front crawl, and you can get them to show you how they put their hand in the water, and then you can give them a force against it so that it's like them pressing against the water, that kind of thing.
Interesting. Yeah, okay.
Sometimes it works, sometimes it doesn't, because they, like I say, they might not want to go into that position on land because they don't ever feel that that's what they're doing. It's kind of the awareness that people have in the water is very different to you like on land. And sometimes when you watch people in the water, you might say to them, oh, you're overreaching on backstroke, and they're like, oh no, my hand's going in line with my shoulder. You're like, so they think they're going in here, but actually they're like over here.
Yeah.
So, and you ask them to show you on land what they're doing, and they go, I do this. But
they're
not
really
actually doing it.
Very interesting. Yeah.
I don't know. It's experiment, see what works for you, and go.
Yeah, it's like with running.
With someone. Yeah,
the other runners who say, oh yeah, I'm definitely a forefoot strike or something, or I land on my heel, and then you actually put them on the treadmill and show them, and they need that visualization before you can move on to whatever the gateway training or whatever it is, because we've got a picture in our mind of what our body's doing, but we don't know it for real. So swimming analysis, actually having a video and slow motion stuff might be quite important for giving that visual feedback. Jenny, what do you do? Do you always kind of drag them down to your local pool, or down to the channel, shall I say? How do you get to see them swimming? Have you got a pond in your clinic?
Well, no. Video really, and
is
just,
it? All right.
Yeah, I think that's probably the easiest, or going down and seeing them, depending on how sort of viable that is really. I think it's communicating with a coach as well to get the feedback from them, because really, as Carla said, you can't replicate it, because the buoyancy that you get from being in the water just changes the biomechanics in your body just from that situation.
Definitely.
And certainly from my point of view, the type of people that I see are in wetsuits, which has another complication totally, because it restricts your movement more. That you do have swimming wetsuits, and they are meant to fit nice and snugly, but you have restriction in them. You know that you can't really get away from that, because you're meant to, they're meant to give you a bit of buoyancy and to also keep you a little bit warmer. So that just adds another kind of element. So sometimes it's worth seeing them fitting in their wetsuits, just to check that they have got what kind of range of movement they've got in their wetsuit. So there's a sort of different things that you can kind of approach, but I would do this as well, I think, because I think that's the best type of idea. But essentially, you just have to use your skills of talking to somebody and your investigation skills and asking them, really detailed questions about how they feel at the end of a training session, and maybe getting them to record that so you can kind of see, whether they feel more fatigued after having done something particular, and try to piece it together as to what might be occurring.
That's so interesting, that the wetsuit. Yeah. Are they wearing something that's too tight or too loose? Because that's going to affect. Yeah, amazing.
And
mind blown again.
Not to throw something else in there, but if you're working with a para swimmer,
yeah,
that totally changes it again.
Yeah.
Because depending on their disability, if they're a blind swimmer, they can't see what they do in the water. They can only feel it. And then you have the added complication of how do they communicate that to you. If you're working with a swimmer that has limb loss, their buoyancy is totally different, and how they perform the skills is totally different. It's how do you then work with them to get them to understand what you want them to do. We take for granted the fact that we go, right, I'm going to show you an exercise and I need you to do it. They can't see it. How do you get them to do that exercise? You have to physically put them through it and get them to feel what it feels like, and then communicate with you on that front. So I think sometimes working in para swimming especially, you have to up your communication a little bit to the next level, because it's the only way you can sort of deal with that. And I think we found at the Worlds as well, not everyone speaks English.
Yeah.
So you've then got that added complication in there as well, that you need a translator with you when you're talking to the athlete. So there's a whole host of very sort of intertwined complications that can make what you think is pretty simple going, oh, I just need them to change their hand entry, then becomes this massive thing, because they can't see you, they don't understand you, they don't know what you're trying to tell them to do. So what we think is, oh yeah, I'll just get them to go from here to here, then becomes crazy difficult.
Yeah.
Wow, fascinating. But I imagine, and this is a topic that Alistair Beverley, the learning disability physio, talks about, how we can learn, we can become better communication with able-bodied or able-minded, or people with kind of who haven't got learning disabilities, or if we work with them, with people who aren't able-bodied, because you learn other skills, you learn how to communicate better when you're working with somebody who maybe can't give feedback to you, whether it's because they can't talk or you can't understand them. So I imagine has there been a carryover of skills from your experience of working with Paralympic para-athletes and that, which is carried over to working with able-bodied swimmers?
100%, I would say 100%. I think because with para-athletes, you treat the individual as an individual, if that makes sense. So you absolutely work on, you try and ignore everything else that you've kind of learned, and sort of really try and hone in on their specific problems, and not have any preconceived ideas of what they can or can't do. You kind of just have to accept what they are able to do, and then tailor your treatment plan to that, which sometimes means really thinking outside the box and really coming up with different ideas as to how you're going to treat them, because you have to, because you can't treat them, you can't always treat people in the same kind of way. So yeah, I think so. I think it really helps you, A, with communication, but B, thinking outside of the box a lot more.
That's very interesting.
I'd 100% agree with that. I think the more I think it also makes you a better therapist as well, because you are more confident to ask questions. A lot of people are scared to ask questions of para athletes, and I think you just have to be brave and ask those questions. And actually, I don't want to say there's a right and a wrong way to do it. I think being understanding, but being direct. Don't kind of skirt around the issue. Ask them, and they will tell you. They're really happy to do that. But yeah, definitely, I think, like Jenny said, treating them as an individual. We all know it's not a one size fits all for in any sort of treatment, but more so, I would say, with your swimmers and things like that. It has to be very individualized, whatever plan you do, whatever treatment you do, and just sort of go from there. And then that transfers massively into your everyday work as well.
Definitely. No, that's really interesting. Yeah. So it helps you appreciate that everybody you see is going to have their individual differences, and you have to think outside the box and make sure that you're not assuming anything, and getting a great subjective in there. Brilliant. Love it. I'm interested in difference between male and female swimmers. Is there a difference in susceptibility or prevalence of injuries? Do you know?
Yeah, I mean, ultimately, I watched the 𝐬𝐻𝐼𝐻 shoulder podcast you did before, and just really going back to the whole menopausal woman type of thing.
Good point. Yeah,
there is, you know, a lot of menopausal women love cold water swimming and tend to go for more in my humble experience, tend to go for some more open water swimming, just because of the benefits that they get to their menopausal symptoms, and they generally have, as you know, as we all know, a bit of a prevalence towards potential shoulder injuries anyway. So yeah, and also I think, you know, shoulder instability is quite common with us all sitting at desks and doing this type of thing and driving long distances. So you can already be at a in a position where you could potentially get overuse injuries just purely from posture and what you're doing in your everyday life. That just comes to the surface a little bit more readily, I think, in a swimming environment, if you're doing lots of repetitions of it.
Interesting. Yeah. So yeah, bearing in mind if they are in menopause, then yeah, potentially there's going to be slower recovery for tendinopathies and things, more susceptibility to tendinopathies. Very interesting. And Carla, for you, is there any difference have you seen in your experience or research?
To be honest, I wouldn't. I don't really know. I don't think I've seen more boys than girls. Like, I think it's been sort of like similar across the board. I think the difference will probably come as people get older. Like, sometimes they will, because as they become more specialist in a certain stroke or a certain distance, that's when you might tend to find things coming from that. But I would say mine's been pretty equal. Or I've just been really lucky that it's been equal. I don't really know. But yeah, it's I don't know. I don't know if I've seen more injuries of a certain type from one person than another. I couldn't really tell you, to be honest.
What about something like hypermobility? Is that a problem for swimmers? Does that open the door to different injuries? For those listening to the podcast, both nodded emphatically at me like I was asking a crazy question. Like, you think? Maybe I should rephrase my question. In what ways can hypermobility cause problems when you're working with a swimmer?
Well, like I said earlier, the feel in the water is a big one, because if you're trying to get someone to sort of go straight, because of the way that they are sort of like built shoulder wise, they can overreach, which then has a detrimental effect through the rest of it. And also, a lot of people think that you move in swimming by just kicking down in the water. So let's say, use front crawl as an example, like you actually kick up as well. So you have to go down and up. If you've got hypermobile knees, that can create like quite a big issue there. Like, if you're doing loads and loads of just kicking to develop your speed, develop your strength, things like that, because you're putting force on the water on the downbeat and you're putting force on the water on the upbeat. Yes, in the short term answer to your question, yes.
No, great examples. Yeah. I'm thinking of what I say to students now often when I'm saying there's no such thing as a stupid question. I'm just reminding myself of that. I'm hoping I'm asking the questions which listeners are thinking. I'm talking of questions. There's an interesting question here from Israel, who's a fantastic barber based in Hove. I just recommend him entirely. But Israel asks, is it beneficial to swim for shoulder recovery? This is an interesting angle, actually, which I didn't think we were going to mention. But do you find that yes, swimming can be beneficial when you're trying to help somebody recover from a shoulder injury?
I would say that's very dependent on what the injury was in the first place and what their swimming capability is. If they are, let's say they're somebody who always swims breaststroke and the issue that they've had as an injury has been from, I don't know, like an overhead movement, then they should be okay to swim. Don't take that as gospel, like, but because it's non-weight bearing, if you're doing it recreationally, then potentially yes. If it's a competitive swimmer, then that's a whole different, like, return to play kind of protocol and things like that, and lots of adaptations in training and things like that. So it depends on the injury, basically. It has to be individualized. It has to be tailored to what they're doing, that sort of thing.
Good safe
and
answer.
I would imagine open water is different again.
Yeah. Yeah, absolutely. Just because of the length and distance, you know, you've got to think of safety before you get into the water. And if you're going to get into trouble when you're far away from the side, you do have an injury. It can be tricky. But equally, sort of going a little bit back to the hypermobility stuff, sometimes I've got a particular friend actually who's she does a lot of open water swimming, and she finds that swimming in a wetsuit is helpful for her because it limits her range of movement, and so she finds that it stops her from sort of going too far, basically.
Very interesting. And that goes for the knees as well as the shoulder. You've got that restriction, and interesting.
Yeah.
And is it a case where, I mean, that kind of moves me into the next thing I wanted to talk about, kind of injury prevention or reduction of risk of injury? I mean, I know in running it's very tricky to talk about what helps reduce injury, because injuries is so multifactorial, and it's very difficult to reproduce studies in that. But strength training, is that something that is recommended for swimmers and has been linked with reduction of injury, or just recommended for performance, or how does that work?
Carla, I'll let you go for that one.
So if we go right to the very top, British Swimming have produced protocols for swimmers to follow, which they call, like, people will know it as like RMAP or ramp, which is to raise, activate, mobilize and prime muscles. They have built a framework of exercises and things around that, which swimmers will spend a lot of time dry land doing that before they even get in the pool for a warm-up. So they might be on deck half an hour, 45 minutes before their warm-up start time, and they will be doing this warm-up protocol. That is then filtered down through clubs and things like that, and you can easily access it online. Sort of like, you can Google it and it will come up. It will give you a whole host of exercises and different levels of those exercises. But doing that before they go in the water, then they'll generally do a pool session. They'll get out and they'll stretch afterwards, and then they do a lot of gym, like a lot of conditioning work, like full body work, and a lot of lifting heavy weights. So I think the combination of everything together is helpful and is kind of built into swimming. So but again, it depends on your level. If you are just going recreationally, then there are certain things that maybe you can pull out of that, like RMAP routine, that you can use before you get in the water, they're not going to stop you getting injured, because as we know, you can push off the wall and roll your ankle. Like, it's not a guarantee, but it can be beneficial. And like going in the gym, yes, we might want to work a bit more sort of like shouldery or hip work, but fundamentally doing full body strength work is what you need to help make you a faster swimmer.
Yeah.
Really.
Yeah, I guess it is all about power, isn't it, and force, and being able to push through the water and prepare yourself forwards, because it's not like with running, there's no kind of like recoil or using ground force or anything. It's purely, if you don't move, then you're not going to move.
Yeah.
And you've got to do it in a skillful way. It's fascinating. It's so interesting hearing about it. Just to help Israel here with his shoulder. Yes, shoulder dislocation. The GP advised me not to swim, but I carry on doing it and my shoulder feels better afterwards. Should I follow the GP advice? Very tricky to say, isn't it? We can't go against what GP said. No. But then again, you know, this is one of the things we've talked about in other episodes. I mean, GP probably had 15 minutes or so to talk to you and advise you. And it's something really you need to talk with your sports therapist or sports physio or somebody who you're seeing, because it depends on you. And it depends on what level. It might be a static kind of movement in the water just to get some mobility and a little bit of force, a bit of loading might be great for you, but it very much depends so much as well. Sorry, so we can't help you with that. I'm not going to give you a definitive answer. But I don't rely on advice just from a 50-minute consultation. You need a bit more than that for them to give you an educated answer. In most cases, sometimes not. Depends on what your situation is. But hope that helps. Israel, people who are listening to this, Carla and Jenny, and they're thinking, wow, these guys have suddenly made working with swimmers sound really interesting and varied. And I love the idea of it. What is some of your tips for getting to work with swimmers? I mean, you've taken it to like elite levels, working at Commonwealth Games and working for Invicta Games and all sorts of wonderful places. And I'm sure it's been great. But what's the first thing that therapists should start doing if they want to get some more therapists coming through their door? Any tips?
And I always find that if you have an interest in it, do a bit of swimming yourself. Go down to the pool, maybe turn up a couple of swimming clubs, have a chat to some of the coaches, be a bit interested and curious yourself, do a little bit yourself, and then see if it is something that you really enjoy yourself, I think. Make some friends, speak to the coaches and see if your services, see if they can help, see if you can help them in any kind of way. Provide. So
what sort of events are you talking about? Again, for somebody who's totally ignorant, I know Park Run for Runners great every Saturday morning, 9 o'clock. But what sort of swimming events could therapists go along to with their sports therapist jacket on or whatever, or t-shirt, and start hanging out with and talking to people?
I would say you'd have to target your local leisure centres, and you would have to look at the timetables and see if there's a swimming club or a tri club that use that pool as their training base. You should be able to Google and find contact information for the head coach or whoever's in charge of that session. And I would make contact with them and say to them, this is just introduce yourself. This is what I want to do. This is who I am. Like, could you use my services? Like, I think you have to be prepared to do a little bit for nothing to start off with. I know some people hate that, and some people will go, I'm absolutely doing nothing. I need paying for my time. I totally get that. Our time is precious, and we do warrant being paid for it. But actually, the voluntary stuff gets you in the door. The voluntary stuff then opens the other doors to bigger and better things for you.
And ultimately,
and if you're good at what you do as well, if you are rubbish, they will very quickly go, thanks, but no thanks. Like you have to build that reputation, you have to build that trust, and go from there. Really.
And I think ultimately, what's 1 or 2 hours versus however many hours that you could be gaining from swimmers who then coming to you from outlaying like a couple of hours of your time. I've also offered coaches free sessions so they can come in and see what I do.
Nice tip. Yeah.
I think it really comes from them. You know, they're the people who can then say, actually, I know somebody who could help you, and I know that, and they can then understand what your role would be alongside their role, so they can then so you can work synergistically together, I think, and it develops a good rapport with them too. So
that's a great idea. Get that going, because then you could have that referral where you're getting people who need a coach. You're thinking, I'm not competent to coach, so I'm going to put you in contact with this great coach, and then the coach can send you people who are suffering from pain. And yeah, that sounds like great. Get your network of referrals going.
And I think is if you, again, I'm delving more into the competitive world, but a lot of swimmers spend more time with their coaches than they do with their parents. So a lot of coaches know a lot more about those individuals than their parents probably do. So having a good relationship with a swimming coach, I would say is key, because they will be like, oh, they came into training at this time on a Monday and they said this hurt or this whatever, or they will be like, that's not somebody who normally complains about anything, so when they say that they are in pain, they are in pain, kind of thing. So, and you don't always get that from a parent, and I think, like Jenny says, if the coach believes in what you're doing and is happy and confident in your skills, if they say to the swimmer, I'd like you to go and see Jenny, the swimmer will be like, oh yeah, cool, because coach says it's good, I'm off, like that kind of thing, because they will just hang on their every word, kind of thing. So I think that's a key thing to look at, is making those links with local clubs. And possibly the same for like open water, like tri clubs, they'll have people there in the pool, but then they might say, oh well, we actually train at the lake at this time on a Friday night, come down there, meet everybody.
And you do tend to find that triathletes are quite passionate and do spend a lot of their time training, and so to them it's very valuable to make sure that, you know, if they're starting to feel a bit fatigued, they might want to come and just see you on a regular basis. And in a similar way with running, really, you can slot it into their training plan so that they come to you for a bit of recovery, like post-event, pre-event, at the end of blocks of training blocks. You know, you can work it really nicely alongside the coaches. So again, it's kind of good to work alongside them from that point of view.
Great advice. It does often boil down to not forgetting. It's so difficult, and we're going to do with this next week, but social media and the digital worlds kind of make us think that we don't have to go down to the local club and just talk to people and make relationships, but it doesn't replace it, does it? Especially if you're trying to get into a new market, you need to meet these people maybe a few times just to get their confidence, and then establish contacts that way. So yeah, getting down to your local clubs. Great. Amazing advice. I think Cecily has summed it up nicely here. Cecily Hislop says, as I know nothing about swimming, good, it's not just me, it's been great finding out about what swimmers do to aid their fitness and strength. Fantastic. And I guess if you work with triathletes and you're very confident about the running, thanks to what you guys have talked about today, I mean, there's a little bit of education, obviously, but having that confidence to work with swimmers as well and talking to them, a lot of it, the subjective that you've mentioned, getting to know them and treat them individually, there's lots of crossovers, isn't there? If you're a great therapist and you do these sort of things, then you can work with somebody from a different sport, even if it feels a bit intimidating at first. So great advice. Thank you, Cecily. Right then, 8:55. If people are interested in following you guys on social media, going back to social media now, Carla, you're on Instagram, Sports Massage by Carla. Yeah, they can follow you there. And also Facebook, if you look up Carla Bickerstaff Sports Massage, it will take you to the Facebook page. Quite active on those, worth people following you? What sort of thing are you putting out?
Yeah, it is. I would say that they're linked together. So I only post to one. I make my life easy.
Sensible.
But I would say, yes, I always went into social media with I am not posting every single week, because then people come to expect it. And I'm not that kind of person that can keep up with that. So it is a bit ad hoc. I would say a lot of my stuff on there is event based, about where I am, what I'm doing, that kind of stuff, who I'm with at events. But yeah, definitely, if people are interested in that, then yeah, give it a go. If
give
not,
you some good ideas about
off.
what you're up to. That's no way to look at it. Fantastic. And Jenny, you are on Facebook in particular, Jenny Lane Sports Massage Therapy. And you work at Loughborough Physiotherapy and Sports Injuries Clinic as well, don't you?
Yes, I do. Yes. And so I've got a presence on there as well.
Fantastic. We'll put those links into the show notes so people can read about you there and what you do. It must be really, so you work in a multidisciplinary clinic then?
Yes. Yeah. And it's fabulous. I used to own my own clinic for 15 years. And just with my husband's job, I've had to move around the country a bit more. So I've worked lots of different places, and I've worked as a sole trader, and I've worked at Bisham Abbey as well for a while before I came to Loughborough. So it's been nice to get to work in a multidisciplinary team. And I'm really lucky, the places that I've been into, that they believe in what we do as well. And
fantastic. That's great to see. No, it looks like a really good outfit there, with different disciplines contributing. That's great. Fantastic. Well, thank you, Carla and Jenny. It's been really interesting. I'm hoping that listeners out there, particularly those who are interested in working with swimmers but don't, It's been a great eye-opener with great ideas and suggestions. Next Wednesday. That was a very quick hour, Carla and Jenny. Really, that flew by because I was just clinging on to every word. Thank you for that. Just amazed that I'm already at next Wednesday. Yeah, we are coming back next Wednesday, not next Tuesday. It'll be next Wednesday again. We are going to, actually, it's a nice little segue talking about digital and social media. We're going to be talking, it's going to be part one of a two-part focus on AI, so artificial intelligence in healthcare. And it was stimulated by a piece I saw by the amazing Joe Turner of 𝐵𝐸Hab.co.uk, who I've been dying to have on the podcast for ages and have never just reached out and contacted. But this it was a really nice article that Joe wrote. I think it was in MSK Mag. It was Dear ChatGPT, are you going to have my job one day, or something like that. It was great. And it's talking about to what extent will AI ever replace human health practitioners. So that's going to be next week, which I recommend that you come and join us live. Like I say, Joe Turner is a fantastic physio and so much more than that with regards to understanding pain and just client relationships and communication. It's going to be a great episode. And then part two, back to Tuesdays on the 16th of July, my guest is going to be Marcus Slade, who's co-founder of PhysioGenie Technology, who's going to be discussing actually what we can use AI systems for if we're going to move into modern therapy practice and how AI can help us without taking over and us just not turning up. I think they've opened now. There was an article in The Guardian, I'm still got to find it, how there is now an AI physiotherapy being offered where it's just purely run by AI, which scared Joe to death and annoyed her and made her write this wonderful piece in MSK Mag, which is great because the day that comes where we think we can help our clients without having to be there and just using AI, that's a very scary time, and it's just doesn't replicate what we do at all. So anyway, right, so that'll be next Wednesday if you'd like to join us, either on Sports Therapy YouTube channel or Sports Therapy Association Facebook. But anyway, for tonight, once again, thank you, Carla and Jenny, for giving up your time.
Thank you.
Really appreciate it. Thank you everyone who joined us live, and for people who joined us listening to this podcast. If you are listening to the podcast, and do please leave a rating and review if you've enjoyed it. It just helps the great word of our guests get out there more. Glenn Murphy also has summed it up nicely. Sir Glenn Murphy, sorry, Glenn, says, totally agree, Cecily. I can't believe I've never chosen a swimmer. Great to hear this info. Wonderful. If we've instilled some confidence, not me, if Carla and Jenny have instilled some confidence into you, Glenn, to work more with swimmers, that's fantastic. It sounds like it'd be a great crack. Be really rewarding. Right, that's it, people. Thank you very much. Carla and Jenny, don't go anywhere. Don't press any buttons. I just want to say thank you to afterwards. But for everyone else, hope you enjoyed the episode and hopefully see some of you next Wednesday, 8 o'clock on the Sports Therapy Association podcast. Take care.